It is our KSAT Q A where we try and clear things up with some of the major issues that are happening. And as we have every Wednesday, we are pleased to be joined by San Antonio Mayor Ron Nirenberg. Mr. Mayor, thank you for joining us. One of the things that I'm not sure we're going to get clarity on in this conversation is what is happening with schools right now. I think the Metro Health directive has been called into question. You've got the Attorney General out there, and I know that you sent a letter to the governor, and that's basically saying clear this whole thing up for us, correct?
Yes, absolutely. So let's level set for a second. The Attorney General of Texas issued an opinion. It's no more than an opinion. It's his interpretation of the law. But as it stands, based on what we have heard from the governor thus far, and the authority given to local public health authorities, such as the Bexar County Health Authority, Dr. Wu, the directive issued by her about a week or so ago carries the weight of law until we are told differently by the governor. So the directive is with some exceptions, of course, but schools will not be in person until after Labor Day. And exactly when will be determined over the coming weeks based on the level of infection in the community. But distance learning is how we will start schools until after Labor Day. We've asked the governor to weigh in here because we're getting conflicting messages from the Attorney General, and the TEA weighed in yesterday with even more contradictory statements saying things about the funding, which they've contradicted again this evening. So it's a bunch of confusion that only the governor can sort out.
On a related note, I want to ask you about that lawsuit brought on by Cornerstone Church. When this decision was made to hold off on in-person learning, I imagine that decision was made in conjunction with the city attorneys. In your talks with them, what are they saying about this lawsuit, and does it have any merit?
No, and that is because, again, when the local public health authority weighs in with a directive, she is looking purely at the science and the medical data, the facts, in order to keep our community safe, in order to keep teachers, staff, students healthy, and to ensure that the schools open in a safe manner. It doesn't matter if it's a private school or a public school. Those health data don't change. And so the directive applies to the community. Now, if there is conflicting guidance given by the governor, then that might change things. But at this point, it applies to public and private schools alike. There's no difference in terms of the health data that she is looking at.
Now, there's some schools that like the Bernie ISD, obviously it's centered in Bernie. It's not in Bexar County, but it has a couple of schools that are in Bexar County, and that's kind of been a gray area in this whole thing. Any clarification on what happens with those schools that are in Bexar County? Are they under that health directive, or are they under the purview of what Bernie ISD decides?
Right. So 48 hours ago, we were having discussions with the TEA to clarify that point, and they were ready to issue guidance to clarify exactly where the jurisdiction lies. But if we're looking, and they didn't give that, instead they gave a lot of conflicting comments about the Attorney General's opinion. And so we're kind of where we were before, and that is the local public health authority of Bexar County, Dr. Jinda Wu, has issued a directive that applies to all Bexar County schools. So if you're in Bexar County, the directive is schools will not open in person until after Labor Day.
In your briefing today, you said that you're using guidance of the medical community to help determine when it's safe to reopen schools. Is that guidance pointing to a general time frame when you think that will happen?
What we have now is the model that I showed last night, and I think y'all had it on, I think last week. But it's showing that we are plateauing. That's good news. If we all keep our guard up and we continue our physical distancing and wearing a mask and really doing everything we can to control the spread of this virus, the model shows that we're going to start declining in infections. And so over the next couple of weeks, we'll start to see the numbers come down. Now, next week, the Public Health Authority is going to be meeting with all the stakeholders, again, school boards, teachers, parents, even some students and pediatricians and the medical community to come up with what those benchmarks are. One of the things that we know they're going to be looking at is the positivity rate of the infections. Right now, we're at 17.5%. High transmission going on in our community right now. They want to see that come way down, likely around 5%. You remember back in May, we were right around 3.5%. That shows you the level of spread that's occurring in our community. They're also going to want to see a 2-week decline of cases, which we hope we're starting right now. And then they'll be looking and talking about some other indicators. But by next week, this time, we will be publishing on the website exactly where we are with the school opening indicators to make sure that we're on the right track.
And the hope is clearly that after Labor Day, schools can open, as near normal as possible.
That's right. We all want to get back to school as soon as safely possible. Look, I'm a dad. I have a 12-year-old son at home. My wife and I want him to get proper instruction and the nurturing that occurs in the school environment. So I understand that frustration. But what every teacher and student and parent want also is to ensure that their child is in a safe environment. And so that's what we want to do. Now, we have the ability to get back to school. All comes down to, can we keep up the physical distancing, blocking that virus from spreading to another person by wearing a mask, especially when you don't even know you might have the virus. So wear masks, do those things now. And as we know, the effects of the decisions and the behaviors that we have right now will show up 2 and 3 weeks later. So if we're interested in getting back to school by Labor Day, we need to buckle down now, because what we're doing right now will show up in the data at the end of August.
Mr. Mayor, the issue of in-person learning is not unique to SA. Certainly, there's other communities, other metro areas that are going through this. Are you talking to any other mayors in other communities, and how are they dealing with this?
I am, and they are likewise pulling their hair out. These public school districts all across the state of Texas are thrown into a state of disarray and upending all of the planning that they've been doing because of what the Attorney General has stated yesterday that completely contradicts the TEA, which now they've contradicted, as well as what the governor has laid out. For the last month, we've been operating under a set of expectations that the local public health authority will offer the health guidance that governs these schools opening in a safe manner. And that's what we've been doing. And all of a sudden, the table has been upended by comments made by the Attorney General. So we're seeking clarification, but I can tell you our standard here is that schools will open as soon as safely possible. That's what we all want.
Quickly, I think we have about 30 seconds left. Talk about the decision to go to 7-day averages and maybe look a little harder at that than what we see, on a daily basis.
Sure. We've been reporting daily case numbers of infections every day for the last 3 months, 4 months, and they're very volatile numbers. One day they're up, one day they're down. And that's not a true indicator of the infection rate over a 24-hour period, because we're getting test results back from different labs all over the country at different rates. It's more of an effect of, how often those labs are reporting data. What's a truer indicator of how we're doing on this infection from a day-to-day basis is that 7-day average, the 6 previous days and today what we're reporting. And so we're going to start showing that number every day now. It's been on our website, but we're going to start putting that number out. It's a much less volatile number, and it can show the tracking of the data in a much more reasonable manner.
Mayor Ron Nirenberg, as always, thank you so much for your time.
Yeah. Thanks for staying up late with us. Yeah, thank you.
We'll be right back.